Hello and welcome to the Patient First podcast. I am your host, Dr. Bryan Laskin, where we are, of course, going to be talking about the great disconnect between dental teams and dental patients and how bridging that gap is the best way to grow the practice of your dreams. Now, I just am jacked. I'm coming back from a couple fantastic meetings, 2 trips in one. Last week, I went to La Jolla, California, and went to a business masterclass where I was learning about sales. I was learning about marketing, how to build a great team. And if you, as dental professionals, are listening and you haven't gone to a business course outside of dentistry, I would highly recommend it. I mean, you learn a lot of things that you might not, because it's a very different perspective. Obviously, there's great training within dentistry. We do lots of great training at Upgrade Dental, but there's also expanding your horizons out to go outside of dentistry, I think brings a lot back to your practice when you do that. But that's not what I'm here to talk about today. Today, I'm talking about the second leg of my trip. I went to Las Vegas, Nevada, and went to Dentsply Sirona World, which is one of my favorite dental meetings there is. It's great entertainment, great speakers, great content, great vendors. And I've been there every single time since the very first CEREC meeting. And I think I've actually exhibited with Opera DDS and Digital Nitrous and several companies. This time I was signing my book, The Patient First Manifesto, in the Vine Dental booth, which is a great company that took over Opera DDS, that takes all the billing issues out, takes the friction out of the revenue cycle management. But what I want to talk about today is the entertainment. Now, I was only there Thursday night. I didn't see Gwen Stefani or the Chainsmokers, but Thursday night, there was an entertainer who I think was great, but also very telling about what we talk about on this podcast. That entertainer was John Mulaney. Now, John Mulaney is Spider-Ham, as you see him here in the Spider-Man Into the Spider-Verse, one of my favorite movies. It's a great animated movie. If you like cartoons, it's a good one. But John Mulaney was great. And now I'm not saying he was a great comedian, because you could argue whether or not that somebody's funny. That's subjective. But he was a great communicator. And I think it is indicative of the great disconnect that we talk about on this podcast. And here's why. When John Mulaney spoke to us, he came out, and the very first thing he did was talk directly about Dentsply Sirona World. He talked about the tagline for Dentsply Sirona World, which was smiles to connect people, or so. I don't even know what it was, but he talked directly about that. He talked about dentistry. He talked about dentists that he met at the craps table by name. He had them written down. He talked about courses that were going on. He joked and he said he has nothing to do with dentistry, but he knows lots of dentists because he's been to rehab a couple times, which was a joke that's unfortunately probably a lot of truth to it. But the whole time he was focusing his act on dentistry. He even interviewed the audience, and obviously it was dental professionals, and he didn't ask what's your favorite movie or what's your favorite food. He asked them about their area of practice. And while he did this, there's one big response, and it was this. People were like booing him and laughing at him because he mispronounced dental terms, because he didn't know one lady was a prosthodontist. And he said, "What's a prosthodontist do?" And there was just vitriol coming back from the stage, that how the nerve of this comedian not knowing the job of a prosthodontist. I think if you asked 10 general dentists what a prosthodontist did, you probably would have 10 different answers. And we're like throwing vitriol at this poor comedian. Well, not really poor. He probably got paid more money than we make in 5 years to do that 1-hour joke comedy routine. But when he asked one dentist, actually 2 different dentists, what their specialty was, and they said general, he said, well, that's not a specialty. He was mocked. And I think that it is very telling that when the comedian is up there talking directly to dentists about dentistry and we're mocking him for the attempt, it's telling. In fact, one person even flipped him off. I can't remember what it was, and he was not being rude to the person. It was something about not knowing what the specialty was, that this dental professional felt like they should give the comedian who's trying to talk to them about dentistry the middle finger. And John Mulaney, the comedian who just got out of rehab, made a joke about it, was graceful, and moved on. But the dental professional flipped him off because he didn't know some dental terminology. So what's my point here? My point is the point that we always have on the Patient First podcast. It's an illustration, a fantastic illustration of the whole point that we have in the podcast, in my book, The Patient First Manifesto, what I believe we need to do as an industry. There's a dichotomy between John Mulaney's communication and with the audience, the dental community. It's very drastic. John Mulaney is a superstar comedian. By superstar comedian, I mean he gets paid a lot of money to do jokes. And why does he get paid so much money to do jokes? I believe I saw it that night. He was attempting to talk to the audience from our point of view, from the dental point of view, not from his point of view. He could have gone up there, and I'm sure he has multiple specials that he does that you can watch on Netflix, which are highly rated. He could have gone up and just rehashed the old material. And the guy just got out of rehab. I mean, that would have been, that's what I was expecting. That's what I frankly was hoping for. I thought he would just do his old material because it's probably his best. But he went beyond that and was trying to talk directly to his audience using their own terms. But that requires a lot of effort. But what's the upside? If you do it, if you speak to your audience in their language, you build long-term relationships and trust, right? That's what people are looking for. They're looking for you to talk directly to them in their language, not try to impress you with their language. We all know that. We see comedians go up or entertainers talk directly about the entertainment industry. I don't know something that's more annoying than listening to an actor talk about acting, right? I'm a dentist. I don't want to have a comedian go up there and talk about comedic terms. No, I want them to talk about what I'm into, which is dentistry. And he knew that about everybody. His miscalculation, however, was that his audience was filled with dental professionals who are unwilling to listen to an outside voice that don't speak our language. Like, we were so mad at him for speaking our language incorrectly. I know dental professionals, everybody listening here is very well-meaning, but we are taught early on in our career that our language is special. You don't say the back of the tooth, it's distal, right? You don't say the tooth is broken, it's fractured, or there's no decay, it's caries. But if we want to connect with our patients, I think it's time that we speak the language that our patients speak, much like John Mulaney tried to do. Look, the good news is that our patients' language is our own language outside of dentistry. We just need to think about it from their perspective and speak to them the way that they want to be spoken to, which is from their perspective, just like John Mulaney was trying to do at Dentsply Sirona World. It's way easier for us to talk to dental patients in a fourth grade language so they understand what we're saying. Much easier than John Mulaney was trying to do when he was saying how restorative dentistry and preventative dentistry should be separated, because you can't be the person that tries to save a tooth and the one that restores it. It's conflict of interest, right? I mean, he was attempting to speak our language, but the jokes didn't land because the audience is so protective of what we do and what we say. Rightfully so, well-meaning, because we get trained it at an early age. But if you want to build long-term relationships with your patients where they trust you, you can't confuse them with dental terms. I think it's time to step off the stage, get into the audience with our patients, and speak their language. So thank you very much, and I look forward to talking with you on another podcast.